The day was Sunday, March 15th. That was the last time we had an in-person worship service at St. Andrew. COVID was already coming to the forefront, and we had begun to alter our practices, including the start of social distancing. The communion hymn that day was One Bread, One Body. As the song goes, one bread, one body, one Lord of all. One cup of blessing which we bless, and we, though many, throughout the earth, we are one body in this one Lord. As one body, on March 16th, a letter was sent to all members and friends of St. Andrew suspending in-person worship and activities for what we thought may be 2 weeks, just to flatten the curve. Later that week, 3 of our members became very ill. COVID-19 was hitting close to home, and if we had worshiped together on March 22nd, the virus would have been worshiping with us. Our synod bishop was encouraging the suspension of in-person worship, so instead, our first live stream worship was offered on March 22nd. Shortly after that, Church Council met and shared one uncompromising objective: to prioritize love and care for members and neighbors as part of the human community. The goal was this: to not be a source of community spread for COVID-19. They tied that objective to our global mission to be open to all, the mission that has driven our church for over 40 years. Everything we have done since has been because of that mission and vision. It's central to the heart of who we are and why so many of us came to call St. Andrew our church home in the first place. Thanks be to God, at no time did St. Andrew ever close. Through it all, our pastors kept on ministering while they, staff, and ministry leaders reinvented the wheel again and again to keep us connected. We limited gatherings for the safety and well-being of people, and while we made some really hard choices, not once did we miss Sunday worship. Surveys and phone calls were made to every member of St. Andrew. 5 Zoom listening sessions were also performed. An early draft of St. Andrew's Plan to Gather was crafted and was quickly becoming known throughout the Synod as the draft to follow. Supported by suggestions from the CDC and the work of epidemiologists and the Wisconsin Council of Churches, the Plan to Gather was based on what we all know now and have etched into our minds: that by practicing good hygiene, wearing masks in public, refraining from gathering with people outside of our own households, and practicing social distancing, we could curb the transmission of COVID-19 as we waited to learn more about the virus itself. Meanwhile, our members mobilized. Quilters made masks, members helped care for the homeless at the warming center, and food support was shifted to other partner organizations. Through it all, baptisms happened, people were married, the sick and those in quarantine were cared for by visits from members, all mobilized by our staff. Some of the hardest decisions surrounded funerals and weddings and how to care for the well-being of some of our families who had suffered losses. We all worried about those who were alone or without internet, and those whose mental and spiritual health depended on coming to church. But there was a lot we didn't know, and following Church Council review of the congregational nominations, the Plan to Gather Task Force was born. Thankfully, one of St. Andrew's members was an RN who worked on a team that previously developed local hospital protocols for H1N1, SARS, and Ebola, and was connected to public health. She volunteered to be on the team. In addition, a local dentist aware of the supply chain and health issues, a retired attorney who volunteers for the Red Cross, a city employee, and 2 of us who work in the insurance industry were the 6 people appointed by the Church Council, and from that our work began. With various areas of expertise, we were all learning as we went, just like you. We didn't have easy conversations. We didn't always agree, but we kept and continued to keep our mission at the center of our work. From the beginning, we knew we needed objective criteria. We've kept our data sources the same for our monitoring of public spread. Using the numbers out of the Wisconsin Department of Health for Marathon County, we developed a set of criteria based on 2 factors: burden, that is, the number of COVID cases per 100,000 residents, and trajectory, the trend for increasing or decreasing cases of COVID-19. Our goal was measurable consistency while listening to scientific and medical communities. Using a phased approach, the Plan to Gather Task Force considered every area of the church's life. You can find the full plan on our church's website, www.salc-wasa.org/COVID. Everything you need to know about pastoral care, building usage, worshiping, learning, witnessing, and serving is there. We understand communication is essential, and with the information shared through the task force and the church office, St. Andrew continues to be a community leader in educating and advocating for safe practices and encouraging activities designed to slow the spread of the disease. You may be wondering what's taking so long. Other churches are meeting. Why aren't we? Surely we can do this safely. The truth is, gathering with people from different households for prolonged periods of time is not safe. COVID-19 is transmitted through the air. Singing, speaking, being close in the same place indoors for more than 15 minutes, and all the things that make a church so great are the very things that spread COVID-19 the quickest. We've taken steps to figure out what it would look like to gather in the sanctuary and in the fellowship hall. We've reviewed protocols from Church Mutual about what ushering would look like. The property ministry was consulted about disinfecting supplies. It's not that we can't meet, it's that meeting together causes risk of harm to others. If we limit or restrict the number gathered, if we disinvite the elderly and immunocompromised, if we ask people to register in order to contact trace, if we cause illness to our pastors or their families, then who are we as followers of Christ? As a large congregation in the greater Wausau area, we are a force. If by not meeting, businesses can stay open, community leaders can stay well, hospital personnel can feel supported, and students can return to class sooner, then we've done what God has called us to do. From the beginning, it was never about the building anyway. It was about people with a transformative message, people willing to risk a life of faith, a way of life that was truly open to all because of God's love for all. Each month, Church Council re-examines our plan and criteria, but you're still probably wondering when. When can we get back together? Can we be together by Easter? You can follow along with our plan together as the criteria for phase transition is on the church's website, along with a whole bunch of other resources. It lays out our guiding sources for decision making. While we are moderately high or higher, we remain in phase 1 of the plan. When we find ourselves at a moderate burden, we wait 4 weeks. If we continue to stay steady or move downward in trajectory, then we move to phase 2. If trending continues an additional 4 weeks, we move to phase 3, which is when we resume worship in person and open to all while maintaining our goal to not be a source of community spread. Each week in the weekly wave, look at the chart. The numbers tell us when. When it comes down to it, there's lots of ways to respond as a church. We needed support, and thankfully we've received it from so many of you. On a final note, guidance and ethical support from the Wisconsin Council of Churches added the following encouragement as we continue to work through this difficult time. They remind us to prioritize protecting the life and health of your neighbor. Continue to be provoked into holy experiments. Follow the call to love and good deeds urgently and carefully. Prioritize accessibility honors the diversity and oneness of Christ's church. Take seriously the church's role as a community leader. Believe in the resilience of the church. The past 11 months have been difficult for everyone, and we likely have many similar months ahead of us while vaccines are created and shared with the community. How can you help to hasten the day of our return? Stay vigilant in the practices that are shown to slow the spread of COVID-19. Wear a mask, socially distance, avoid large gatherings, look for an opportunity to be vaccinated. The data shows that life will return to somewhat normal when 70 to 85% of us have received the vaccine. And lastly, have patience and pray. Pray for those with the illness, for the healthcare and essential workers, for our pastors, leaders, and staff, and for others. We are a people who follow Jesus. His way of life, his priority for healing is our priority too. His love for all is why we are open in the first place. We are one body in this one Lord, grain for the fields, scattered and grown, gathered to one for all. Thank you.